I'm Steve Wenman. I'm a staff nurse on the ophthalmic unit. It's been scary. It's been very scary. I work in operating theatres, so we've had patients coming in for eye surgery. We've been full PPE, full mask, full everything. It's been hot. It's been tiring. Some of the cases are 2-3 hours long. You're in that stuff all the time. It's really tiring. You can't stop. You can't get a drink or anything. Yeah, I've got 2 young children at home. My wife's a sister on the neonates unit. We're in PPE all the time. It's just so scary. You don't know what you're taking home to your children. You don't know what you're taking home, full stop. And then I work putting drops in patients' eyes for injections. You're close proximity to them. Again, you don't know. You've got your masks on. I mean, some of the PPE we've been getting has been really substandard. So has it actually been protecting us? It's just been so scary. I've never been so scared in all my years as a nurse as I have been over the last 6-7 months. I'm campaigning for some recognition and the pay we deserve. At the end of the day, we've not had a proper pay rise in years. I mean, the government are saying, well, yes, you've had a pay rise. No, if you look at it, that included all the increments that we should normally get. So we haven't had that at all. We've worked hard. My colleagues, I've had colleagues in this hospital that have been in intensive care unit. We've had colleagues elsewhere in the country that have died from this. And it's so scary. We've even had members of the government in hospital being treated by my colleagues, and now to be told that we don't deserve a pay rise. It's terrible. I mean, my neighbours have been knocking on my door every Thursday, dragging me and my wife out to clap. That's fantastic. You know, the public appreciate what we're doing. But clapping doesn't pay the bills. And when you've got a young family and when you've been through what we've been through, and the other emergency service, it's not just us, the police, the ambulance service, we've all been through it. We need the recognition that we deserve. That's scary. It would make me feel appreciated by the government. It would make me feel appreciated by the people that are supposed to be looking after us, the people we work for. And I know we've got 100% public support. I know that. And I think it'd make the public have a bit more faith in the government, that actually those people that have been out there saving the lives are appreciated. We're one of the few countries in the world now that haven't got appreciated and haven't got recognised for this. I love my job. I really love my job. And I'm really disappointed that so many people don't want to come into this profession anymore. It's an amazing profession to be in. But I can't blame anybody turning around and saying, I don't want to be a nurse. We've got over 40,000 vacancies in this country alone now. Who wants to come into a profession where there's minimal pay? I mean, we haven't caught up with 2010 yet. We're now in 2020. Who's going to come into this profession to end up paying every month to keep registration and stuff and be treated like we've been treated recently? It's a lovely profession. I want people to come in. I want people to stand where I'm standing and see what the public really feel about you. But I don't blame people for not coming into it. I blame the government for stopping people coming into this profession now. All I want you to do is support our campaign. Support the campaign to get the nurses the recognition they deserve. Support the campaign to get us back where we should be so that we are earning the same money we should be in 2020. Not what we should be earning in 2010.